I'm glad to address this important matter as Vice Chair of the Oireachtas Women's Caucus today. And I want to take this opportunity to commend my cross-party colleagues for their work on this issue and to welcome the visitors in the public gallery who are here with us this afternoon. Many people are uncomfortable talking about menstruation. Many people don't want to talk about it. Many people will dismiss the need for this motion. But that doesn't mean that we shouldn't raise this issue. We women are best qualified to talk about menstruation because it is a normal part of life for us. Why should we be embarrassed or ashamed? Why should we buy into advertisers' negative stereotyping of menstruation? For the majority of us, period poverty is not an issue at all. In fact, the term is new to a lot of people, including myself. However, on closer inspection of the evidence provided by Plan International Ireland and Homeless Period Ireland, it is indeed a matter that needs urgent action. It is primarily about the quality of life of our women and our girls. It is not just an issue for other countries, as many of us may have believed in the past, but for ourselves also. Women's health has been viewed through a peculiar prism over the years, despite the fact that menstruation is happening all over this planet, in every country, everywhere, every day, and yet it is almost taboo to discuss it. Why this should be so is curious. I suppose it might be because the female reproductive system has been viewed as unclean in some cultures, including our own. Not many years ago in this country, women who delivered a child were seen as unclean and needed to be churched before they could feed their family or bake bread. So I suppose it's no surprise that menstruation is viewed in the same light, despite the fact that it is one of the 3 ways that the human female body excretes waste. It is a normal bodily function in which we have no choice, just as we have no choice over urination or defecation. However, the fact is that the only sanitary product provided for free in most bathrooms across the world is toilet paper. Perhaps if men menstruated, things would be different. There are many challenges being experienced by women of all ages in managing their health and hygiene on a monthly basis, even if they can afford sanitary products. However, I want to focus on the most marginalised in our society firstly. Homeless women and women in direct provision are particularly vulnerable. Imagine being homeless and all of the challenges that brings on a daily basis. Then imagine being a homeless menstruating woman and having to manage your monthly period on top of that. Think of girls and women in direct provision, where evidence is emerging that the provision of sanitary products is patchy, if available at all. In fact, in some cases, there are reports that the products provided are substandard. This has to change. I had the privilege of meeting Claire Hunt, the founder of Homeless Period Ireland, yesterday at our AV Room briefing, and I want to acknowledge her initiative and drive in not only identifying the needs of these vulnerable women, but then deciding to do something about it. Donated feminine hygiene products are brought by volunteers to direct provision centres, homeless outreach centres and women's refuges. In fact, a donation station has now been set up here in the Leinster House Coffee Dock, which is definitely a first for this campus. I want to acknowledge also the excellent work of Plan International Ireland, which is a child-centred community development organisation. It has provided evidence to us, which has found that 43% of girls did not know what to do when their period first started. 15% didn't even know what is happening to them. 50% of girls between 12 and 19 find it difficult to afford sanitary products, and 61% have missed their school because of their period. The survey also highlighted the lack of information available to them in relation to what is happening to their bodies on starting menstruation, and the fact that they need pain relief at some stage, which also adds to the financial burden. At our briefing yesterday, a social worker based in the National Maternity Hospital also confirmed that many new mothers approach her to provide sanitary products for them due to the cost. If this motion is successful, and I know it will be, and acted upon, then free sanitary products will be provided in all public buildings, such as schools, universities, direct provision centres, refuges, homeless services, Garda stations, hospitals, maternity hospitals, prisons, detention centres and rehabilitation centres. I am optimistic that other buildings in receipt of public funding will follow suit, such as public-funded projects in swimming pools, community halls, centres and theatres. Another vital element of this motion is to ensure that menstrual education is provided for our boys and girls, as well as their parents, to tackle the lack of inaccurate and to tackle the lack of accurate and trustworthy information on menstruation. Learning about what is normal and what is not is crucial. For example, understanding the symptoms of endometriosis, which I understand affects about 10% of menstruating women. An interesting fact that was provided by Equidra is the fact that children from some African countries begin menstruation as young as 7 to 8 years of age. This is normal for them. As many of them are now living here and attending school here, this needs to be taken into account in assisting our primary schools to deal with this fact. I know that our teachers are under considerable pressure in our rapidly changing digital age, so perhaps a solution might be that a special menstrual education programme could be developed and delivered by the HSE. I believe that this is an issue which the Minister for Health should consider under the Healthy Ireland framework, which takes a whole of government and a whole of society approach. Whatever is decided upon, it should most certainly be separated from sex education in schools. It is interesting that some second-level schools are encouraging their students to develop projects on the subject. There are 2 schools, as referred to earlier, St Brickeens from Cavan and Eureka Secondary School from Meath, who were present at our briefing yesterday, and they articulated the findings of their research, which is most revealing about shame and embarrassment in having periods, difficulty in discussing their period with parents or teachers, and the cost to low-income families. Despite their positive opportunity to conduct this research in their schools, there is some evidence that boards of management are preventing such projects being undertaken in schools, so that we have an uphill battle ahead to normalise what is a normal bodily function for half of our population. Indeed, other countries have been leading the way, prompted by young activists. In Scotland, as referred to earlier, the NHS, in Wales, in New York City Council, and here in Dublin, Councillor Rebecca Moynihan, I want to pay special tribute to her. She deserves great credit for achieving support for her initiative in Dublin City Council. We're getting some things right in terms of the 0% VAT on most traditional sanitary products. However, it is hard to believe that 23% VAT is levied on cups, period underwear and reusable pads. These items are not luxuries, but necessities to our girls and our women, and this must be reviewed under budget considerations. And I'm sorry if I'm boring the 2 gentlemen who are sitting up here at the top, having a completely separate conversation to what I'm trying to make a point here, and I think it is not on that there's a conversation going on up here by 2 gentlemen, not fair. You should be paying attention to what's going on here.
Your time is up. I called you twice already.
Well, hold on a second now. Hold on a second there now. I have a couple of... Yeah, well, he was there a good while now, so give us a break here now. Now, the materials that are used in menstrual products also need to be examined and should move to a more sustainable and safer model, as plastics and chemicals are not only bad for the women, but also bad for the environment.
Thank you, Deputy.
Earlier today, the Women's Caucus held a photo call and press conference on the plinth to promote our motion this evening. 4 female journalists were in attendance. Disappointing that 1 male journalist saw fit to attend. Not 1 television station, including our state broadcaster, saw fit to cover this item. So we certainly have an uphill battle ahead to have this important issue discussed more widely when those responsible for covering the news stories don't consider this issue important enough to turn up. Now, this is my last sentence, and I beg your indulgence on this. Minister, you've turned up, and we are relying on you to progress this motion on behalf of the women of Ireland, so no pressure.